Treating hemorrhoids, piles. Hemorrhoids, piles, often clear up by themselves after a few days. However, there are many treatments that can reduce itching and discomfort. Making simple dietary changes and not straining on the toilet are often recommended first. Creams, ointments and suppositories, which you insert into your bottom, are available from pharmacies without a prescription. They can be used to relieve any swelling and discomfort. If more intensive treatment is needed, the type will depend on where your hemorrhoids are in your anal canal, the lower third closest to your anus, or the upper 2/3. The lower third contains nerves that can transmit pain, while the upper 2/3 do not. Non-surgical treatments for hemorrhoids in the lower part of the canal are likely to be very painful, as the nerves in this area can detect pain. In these cases, hemorrhoid surgery will usually be recommended. The various treatments for hemorrhoids are outlined below. You can also read a summary of the pros and cons of hemorrhoid treatments, allowing you to compare your treatment options. Dietary changes and self-care. If constipation is thought to be the cause of your hemorrhoids, you need to keep your stools soft and regular so you don't strain when going to the toilet. You can do this by increasing the amount of fiber in your diet. Good sources of fiber include whole grain bread, cereal, fruit and vegetables. You should also drink plenty of water and avoid caffeine. When going to the toilet, you should avoid straining to pass stools, as it may make your hemorrhoids worse. Use baby wipes or moist toilet paper, rather than dry toilet paper, to clean your bottom after passing a stool. Pat the area around your bottom rather than rubbing it. Read more about preventing constipation. Medication. Over-the-counter topical treatments. Various creams, ointments and suppositories are available from pharmacies without a prescription. They can be used to relieve any swelling and discomfort. These medicines should only be used for 5 to 7 days at a time. They may irritate the sensitive skin around your anus if you use them longer than this. Any medication should be combined with the diet and self-care advice discussed above. There's no evidence to suggest that one method is more effective than another. Ask your pharmacist for advice about which product is most suitable for you, and always read the patient information leaflet that comes with your medicine before using it. Don't use more than one product at once. Corticosteroid cream. If you have severe inflammation in and around your back passage, your GP may prescribe corticosteroid cream, which contains steroids. You shouldn't use corticosteroid cream for more than a week at a time, as it can make the skin around your anus thinner and the irritation worse. Painkillers. Common pain-killing medication, such as paracetamol, can help relieve the pain of hemorrhoids. However, if you have excessive bleeding, avoid using non-steroid anti-inflammatory drugs, NSAIDs, such as ibuprofen, as they can make rectal bleeding worse. You should also avoid using codeine painkillers, as they can cause constipation. Your GP may prescribe products that contain local anesthetic to treat painful hemorrhoids. Like over-the-counter topical treatments, these should only be used for a few days because they can make the skin around your back passage more sensitive. Laxatives. If you're constipated, your GP may prescribe a laxative. Laxatives are a type of medicine that can help you empty your bowels. Non-surgical treatments. If dietary changes and medication don't improve your symptoms, your GP may refer you to a specialist. They can confirm whether you have hemorrhoids and recommend appropriate treatment. If you have hemorrhoids in the upper part of your anal canal, non-surgical procedures such as banding and sclerotherapy may be recommended. Banding. Banding involves placing a very tight elastic band around the base of your hemorrhoids to cut off their blood supply. The hemorrhoids should then fall off within about a week of having the treatment. Banding is usually a day procedure that doesn't need an anesthetic, and most people can get back to their normal activities the next day. You may feel some pain or discomfort for a day or so afterwards. Normal painkillers are usually adequate, but your GP can prescribe something stronger if needed. You may not realize that your hemorrhoids have fallen off, as they should pass out of your body when you go to the toilet. If you notice some mucus discharge within a week of the procedure, it usually means that the hemorrhoids have fallen off. Directly after the procedure, you may notice blood on the toilet paper after going to the toilet. This is normal, but there shouldn't be a lot of bleeding. If you pass a lot of bright red blood or blood clots, go to your nearest accident and emergency (A&E) department immediately. Ulcers can occur at the site of the banding, although these usually heal without needing further treatment. Injections, sclerotherapy. A treatment called sclerotherapy may be used as an alternative to banding. During sclerotherapy, a chemical solution is injected into the blood vessels in your back passage. This relieves pain by numbing the nerve endings at the site of the injection. It also hardens the tissue of the hemorrhoid so a scar is formed. After about 4 to 6 weeks, the hemorrhoid should decrease in size or shrivel up. You should avoid strenuous exercise for the rest of the day after having the injection. You may experience minor pain for a while and may bleed a little. You should be able to resume normal activities, including work, the day after the procedure. Electrotherapy. Electrotherapy, also known as electrocoagulation, is another alternative to banding for people with smaller hemorrhoids. During the procedure, a device called a proctoscope is inserted into the anus to locate the hemorrhoid. An electric current is then passed through a small metal probe placed at the base of the hemorrhoid, above the dentate line. The specialist can control the electric current using controls attached to the probe. The aim of electrotherapy is to cause the blood supplying the hemorrhoid to thicken, which shrinks it. If necessary, more than one hemorrhoid can be treated during each session. Electrotherapy can either be carried out on an outpatient basis using a low electric current, or a higher dose can be given while the person is under a general anesthetic or spinal anesthetic. You may experience some mild pain during or after electrotherapy, but in most cases this doesn't last long. Rectal bleeding is another possible side effect of the procedure, but this is usually short-lived. Electrotherapy is recommended by the National Institute for Health and Care Excellence, NICE, and has been shown to be an effective method of treating smaller hemorrhoids. It can also be used as an alternative to surgery for treating larger hemorrhoids, but there is less evidence for its effectiveness. Surgery. Although most hemorrhoids can be treated using the methods described above, around 1 in every 10 people will eventually need surgery. Surgery is particularly useful for hemorrhoids that have developed below the dentate line. Unlike non-surgical treatments, anesthetic is used to ensure you don't feel any pain. There are many different types of surgery that can be used to treat hemorrhoids, but they all usually involve either removing the hemorrhoids or reducing their blood supply, causing them to shrink.